It's the Eagle Community Television Forum with your host, Gary Shorman.
Hi, everyone, and welcome to the Forum here on Eagle Community Television. It's good to have you watching. Our Forum program today is brought to you by HaysMed, and our guest is from HaysMed, and that is Melanie Urban. And Melanie is in charge of quality patient services at HaysMed. And Melanie, when did you get started in nursing at HaysMed?
I started working at HaysMed 23 years ago. I started as a pediatric nurse, worked on the medical surgical unit, and then went into case management and discharge planning, and then ultimately started working in quality, accreditation, and risk management.
Well, one of the new things that's out, and the reason we want to have you on the program, is to talk about the new patient family advisory team, and that goes all into the quality of what goes on at HaysMed.
Exactly. We're very excited about that. That's the new committee that we've started here at the hospital. We've had our first meeting. It's basically the committee or the team that we put together. It's partnering patient and family members with the healthcare team to help integrate their experiences into the care that's delivered at the hospital so that we can achieve ultimate high quality patient-centered care at HaysMed.
You know, that's really unique in the sense of bringing the patients back in as well.
Yes.
To be able to talk, and are doctors involved, and that becomes sort of an open discussion on quality?
As with our first few meetings, we've not had physicians involved, but ultimately as the team grows and the committee grows, we're hoping to have physicians coming in and out of the committee as well. We started small. We started with 2 patient and family members on our committee. Our goal within the next couple years is to get where we have 80% patient and family members and only 20% staff on the committee. We'll have different people throughout the whole organization coming to the committee to present ideas to the team so that we can get that feedback from the patient and family members.
You know, one of the things I know the hospital uses, and there are some quality measurements that they use everywhere and every year. Tell me about those and how they work.
Well, our organization has 4 high-level goals that we set for the organization every year, and patient satisfaction is always one of those. We have a quality goal, we have a people goal, a financial goal, we also have patient satisfaction goal. We're always wanting to receive high-quality care, but also we want our patients to have that good experience to where they want to come back.
One of the things, you know, I've noticed in being in the industry and working in some related areas, the challenge that hospitals have is continuing to raise the bar for quality because patients expect more quality. They expect it whether it be in entertainment on television or they expect it in stores. Hospitals are no different because patients expect more. And are you seeing that insofar in your responses back?
When patients come into your facility, your healthcare facility or any facility, there's a certain level of standard of care that they expect to receive, but now they've raised the bar and they want that experience. They want their family members taken care of while they're there. They want to feel safe while they're there. They want people coming in and out of their room frequently if they're an inpatient. It's that experience that really sets healthcare facilities apart.
How does HaysMed compare overall when you look, because what I've seen in the area is that HaysMed, not only some of the new structures that have been erected in the last few years, have really given a top quality and really a high bar for the area of Western Kansas.
Our CMS, the Centers for Medicare and Medicaid, requires all healthcare facilities to do a patient satisfaction survey. And with doing those surveys last year, our cardiac progressive care unit received a reward for high patient satisfaction score, and actually Dr. Pope, one of our pediatricians, received an award. And this year, our bone, joint, and spine center received an award for high patient satisfaction scores. So we're seeing some high scores. We always want to improve and make that better, though.
There's 2 sides of it, and I think as a nurse and being on the nursing side, you see this as well. You mentioned that the patients not only want a good outcome, but they want that experience in the hospital. And sometimes that's really hard because when you're really sick, you just don't feel good about anything. How do you train then the nurses and the team after you're done with this? Or what happens once you have the advisory board brings up things? Is that a continuing effort?
It is. The advisory team that has the patient and family members on there is a more structured method to get that feedback from people so that we can make changes, make our policies and procedures more patient-centered. It's a more formal program. We always will have people call us if they have a grievance or something that didn't go right, and we see those as opportunities for improvement, so we welcome those. We also have patients that can call us with things that went well, want to recognize people, but this makes it a little more formal and ongoing, where we're seeking out their input instead of just waiting for patient and family members to engage us.
Well, Melanie, it sounds like a great idea. We're going to come back and talk a little bit more about that, kind of the next steps to this program. Our guest is Melanie Urban from HaysMed. Back with more after this.
It's a beautiful day in our super high-speed internet great customer service neighborhood. Like you, this is where we live. In fact, our company is employee-owned, so it's our goal to improve the quality of life for everyone in our community by delivering faster, more reliable internet, clearer, more feature-laden phone service, quality TV channels, all with the level of customer service you'd expect from people who are your neighbors. Eagle Communications, our community connected.
Welcome back to the second half of our Forum program. The Forum is brought to you by HaysMed. If you have any questions, comments, ideas, suggestions, let me know. My address is gary.shorman@eaglecom.net. You can also find us on Facebook under ECTV Forum. Our guest is Melanie Urban, and she's Director of Patient Quality Services at HaysMed. And we went into the break talking about some of the things, maybe goals coming up for the year. But first off, the people that are on the advisory task force, where did you find them, and what are your plans for finding others to be on that task force?
We started with two individuals who were volunteers at the hospital. So they've changed their role from volunteer to being on this patient-family engagement team. Over the next 12 months, we're hoping to build our recruitment process, our application process, because we're really wanting to get more patient and family advisors on the team. So hopefully, in about a year from now, maybe next January, we'll be advertising and asking for people who are interested and want to be a part of this team to apply and go through an application process. Because, like I said, we're hoping to eventually have 80% patient and family advisors and only 20% hospital staff on the committee.
And I'm guessing you want people that have been through the hospital with
Yes.
experiences both good and bad, so they can bring those sort of
Yes.
that experience back to you to improve on.
Right, whether it's them who had the experience or their family members. And we're trying to get a variety of people. We want some of our patient and family advisories to have children in the system, maybe some that have been through our oncology department. Everyone on the team so far has used our emergency department services, but we're trying to get a variety so that we cap into all of our services at the hospital.
Well, Melanie, I appreciate you being on the program, being
Sure.
a part of it, but I also appreciate what the hospital is doing, trying to make sure it continue to grow, continuing to improve along the line and making that happen. If somebody has a question or comment, can they find you at the hospital? Or are you in the administrative side of the hospital, or how do they get a hold of you?
My office is located inside the hospital, and anyone can call the switchboard, our main number, at 785-623-5000, and just ask for Melanie Urban, and they'll get a hold of me.
Well, I'm guessing if anyone has a question, you'd like to talk to them and
Sure.
have their involvement and feedback.
Sure, absolutely.
Hey, thanks for watching the Forum. Melanie, thanks for being here.
you.
The Forum is brought to you by HaysMed and by Eagle Communications, our community connected.
HaysMed is your first and best choice for healthcare. They're the only facility providing tertiary level services in this region. With more than 70 physicians and 26 specialties ranging from heart, orthopedic, spine care, cancer, obstetrics and gynecology, wound care, rehabilitation and surgery, including the Da Vinci robotic surgery, HaysMed is your comprehensive health provider for people throughout Western Kansas. HaysMed, helping people be healthy.